Shriners Hospitals for Children, Boston, is a very different healthcare setting. First of all, it treats very unique pediatric specialties that you don't find all by themselves. Here in Boston, we probably have about 10,000 encounters per year. We are a referral area for New England and Canada, and we also have patients that come from 70 different countries.
We've gone from just taking care of kids with burns to patients with cleft lip and palate, plastic surgery. It's just amazing how we've expanded and the number of patients we're treating.
We really pride ourselves at Shriners Hospitals for Children in Boston that we're a comprehensive and multidisciplinary hospital, and all of the disciplines really work together as a team in order to provide care. So that is the child life specialists, the physical therapists, the occupational therapists, the physicians, the nurses, and everyone works together and talks about what's going to be best for the patient.
All of the people that are taking care of the children within our hospital are absolutely excellent in their fields and in their specialties within their fields. So that within our stated mission, there is not a condition that we cannot treat, confident that we are giving these patients the finest care that would be available anywhere in the world.
The main center point of what we want to do is for the patient. And so everything is centered around what's the best thing for the patient.
The premier subspecialty that people are used to is burns. And it is a, I'd say, world-class, possibly the best pediatric burn center in the world.
Our burn patients, are typically very healthy, and they have an event, an injury that can sometimes change their course for a while. But if we do our job really well, then they go back to being a healthy kid.
Basically, if your child is able to make it to our hospital and survive a significant or even devastating burn injury, the likelihood that they'll survive is extremely high here.
The research that's been done here in Boston, we're equipped to take care of those kids and get them back on their feet. And I think that's probably really what has made this place the #1 burn hospital in the world.
Now that the children really are reliably surviving, what can we do to make them happy and productive and fully successful?
I can do pretty much everything that anyone else can do. I think playing the piano is a little hard, or tying my shoes, but I do it pretty well.
Every single care provider here is just wonderful, from the doctors, the nurses are phenomenal. So many of them have been here since day one, since over 10 years that we've been coming here. They're all fantastic, and it's a really safe, warm, loving environment.
It was very exciting for people associated with the Shriners Hospitals when the Shrine chose to take on cleft lip and palate deformities as another one of their main missions.
The cornerstone of cleft care is really the two parts of multidisciplinary care and longitudinal care. And I think Shriners, given its history and infrastructure and tradition of taking care of complex pediatric disorders, is really good at both of those things. When the family comes, it's a very family-centered experience where the family will meet every specialist. The focus then is to give the patient the best advice and best surgical planning going forward. So really unique to have all the specialists here in one day for that visit.
When I was born, I was missing the right part of my lip, and I've had a bone graft surgery from my hip to fill up a hole that they could not fill. While after the surgery, I recuperated in here, and the staff, it was amazing how nice they were. This place is just all about love. It's changed my life. It's helped so much.
In the end, it's a team effort that puts these children in the best possible position to succeed. And that's what makes us special here. Everybody works here with a love and a passion.
I am always amazed at Shriners Hospital for Children, the expertise of all of the caregivers that provide care here at this hospital. They are the best of the best.
The staff truly love kids, and you can see it whether it be, the nurses, the doctors, the housekeepers. I mean, they love the kids.
We treat children the best we can, regardless of their ability to pay.
It's the mission that's important, and we want to make sure that the kids get everything that they need to be the best they can be.
To be able to see a child, run again or try to kick a ball, or that's that's childhood, and for a moment in time it was taken away, and in a small way we've been able to give that back to them.
They bring children into this hospital and they just perform miracles. That's the best way to sum it up.